Welcome to the EAUN podcast edition of EAU Podcasts. In this EAUN podcast episode, we are delighted to be joined by Lisbeth Leinum, Bente Thoft Jensen, and Susanne Vahr Lauridsen. Together, they will discuss intravesical instillation guideline. Join us as we embark on this informative journey.
Welcome to this EAUN podcast. My name is Lisbeth Leinum. I'm a member of the EAUN board, and I'm excited to host this podcast regarding the latest update of the EAUN Intravesical Instillation guideline. My guests today are Bente Thoft Jensen and Susanne Vahr, two very experienced nurse researchers with a long history in the EAUN. Please, Bente and Susanne, will you tell our listeners a little bit about yourself?
Yes, my name is Bente Thoft Jensen. I've been a member of the EAUN for almost 20 years and past chair as well. And currently I'm the chair of the bladder cancer sick group and a member of the guideline group. And on daily basis, I'm based at Aarhus University Hospital in Denmark, where I work as a researcher and as a clinical nurse specialist.
Yes. My name is Susanne Vahr Lauridsen, and I work at Copenhagen University Hospital at Halle Gentofte and also at the WHO Center. I work as a senior researcher and do research in clinical health promotion with special focus on rehabilitation in patients undergoing major surgery, and that is bladder cancer patients undergoing radical cystectomy. I started working in the guideline group back in 2007 when Bente was a chair. She invited me in to the EAUN, and then I moved on and was part of the board of the EAUN, and then I was a chair and I stepped down as a chair in 2021, and then I moved back to the guideline groups. I was a chair of the former Intravesical Instillation guidelines that was published in 2015, and now I'm just a guideline member of the update of these guidelines.
So, as we can hear, you have been part of different guideline groups. Can you briefly explain how an EAUN guideline is conducted? Which steps does a guideline update include, and how does it differ from national guidelines?
Yes, we have a very well-described methodology in the EAUN guidelines, and if you look at the EAUN guidelines on our webpage, you can see that we move from practice-based guidelines to evidence-based guidelines. And this means that we have a librarian at the Master University in Canada who do a systematic literature search for us. Then we put all the hits into competence and we do a screening of all title and abstracts. And when we have included all relevant full text, we read through the full text and decide which one to include in the guidelines, which one will answer the overall question that we have for these guidelines. And then the whole guideline group will go through the full text, will write the text, and when we have finalized writing the text, the whole guideline is sent into review to both patient organizations, to the EAU, to the EAUN board, and also to people experienced in the field of the topic for the guideline.
Thank you. I assume that you think that EAUN guidelines are important, or you wouldn't invest so much time and effort in it. But can you explain why? Why are the guidelines important, and how can nurses across Europe benefit from the guidelines?
Well, first of all, guidelines are evidence-based. That means that we include the newest methodology and new updated research results. And altogether, it promotes the quality of care or even enhance the patient pathways. And I think it's important that we adjust our care and care pathways across Europe because we can all benefit from that and learn from each other.
Mm-hmm. Yes, I absolutely agree with Bente. We have a very well-described methodology. And then we actually include topics that's not usually found in guidelines. We have the short description of the patient risk stratification to find out who could benefit from intravesical instillations. We have a description of what is BCG and what is Mitomycin so that nurses can see exactly what is in those things that they use in the intravesical instillations. Then we have described a patient care pathway. And also we have a lot of focus on both nurse and patient safety. And actually, we think this is quite important because there is a huge difference between BCG and Mitomycin, and it's important for especially the young nurses to know if it's chemotherapy or if it's immunotherapy that they handle. We also have, as I said, topics that are not usually described in guidelines, and that is patient assessment, and that is education of both nurses and also of patients and relatives. And then we describe the complications and how you can manage complications, and not only the major complications, but also when you look into the skin complications and the minor ones, which often is very important to patients.
But also we have a paragraph highlighting education of the patient and how to ease the transformation into daily life after end of treatment. And I think that's a huge subject for the patients to be secure and how to move on after cancer treatment.
So I ask you about how the nurses could benefit, but it's also relevant to the patients.
The families as well, yeah.
Bente, you are chairing the update of the Intravesical Installations guideline. You are both in the guideline panel, and I believe you were in the panel of the former guideline too.
Yes, that's correct. We made an update on the intermittent catheterization guideline published in 2024. And now we are in the last phase of the update of the intravesical guidelines. So it's a lot of work. It's very interesting. It gives you a lot of satisfaction to work with very skilled colleagues and build up networks across borders, which I think it's very important for the EAUN as well.
So what are the main take-home messages of the guideline?
The main take-home messages is that we still lack a lot of evidence in this field. Quite a lot of the nursing interventions are still based on best practice. I was actually surprised that we found quite a lot of studies and also new studies about health-related quality of life and the patient perspective. And also that some nurses have started looking into how can you manage the complications experienced by patients to improve adherence to the treatment. But still, there's high-quality evidence lacking in this field.
And now you touched the changes in the guideline. If you should look at the whole guideline, what are the main take-home messages?
I believe we have a bit more evidence for how to manage side effects. The level of evidence has increased, and that's nice to experience. But also, as Susanne just mentioned, there are large studies investigating the quality of life, not only after treatment, but also on long-term basis. And that's some of the studies that we lacked in the first edition. The positive thing is that there's increasing interest in the patient's perspective, not only after treatment, but also before treatment, and what are the preferences for the patients, because not everyone, is keen to undertake this intravesical treatment. So these are some of the main new aspects, I believe, in the new guideline. But also it's important to address that actually the level of evidence is increasing, although not sufficient, I suppose, but we are moving in the right direction.
And the main take-home messages, as you asked for, is definitely that it works. The intravesical instillation is a very effective therapy for non-muscle invasive bladder cancer. But what is important is to enhance patient adherence to the treatment, because we know that about 40% withdraw from treatment due to different reasons. And for the nurses, it is important to acknowledge that this treatment is effective, but there are some health concerns to consider. So they really need to have gone through a thorough education so that they know the risks of the two different treatments from the BCG and from the Mitomycin, and that they are aware especially of the importance of atraumatic catheterization in relation to intravesical installations to maintain patient safety. I think that would be my main take-home messages. And then to add on what Bente said, because that is one of the new things in the guidelines, to include the patient perspective. The education of the patient before giving the intravesical installation is very important, and it is well described in these guidelines, so you can actually follow the steps there and see what is important to assess with the patient and how should the education be before treatment, during treatment, and after treatment. So that would, I think, is a main take-home message.
Yes, I believe.
So you mentioned that there is lack of evidence in some areas. How do you handle these areas?
Yes, that's a good question. But evidence is evidence. And if you don't have the evidence, you have to stick to best clinical practice and sort of get consensus among the guideline group members, and of course supported by the existing literature.
We also use indirect evidence when we lack evidence. For instance, when we talk about meatus hygiene, then we look into the catheterization guidelines, because here you also use an catheter, and then we use good or high quality evidence for not using antiseptics, but just using water and soap before you insert the catheter. And then we use this evidence in these guidelines. And also when it comes to education of patients and relatives, we use evidence from other fields, because this is similar to, for instance, educating about the intermittent catheterization or the indwelling catheterization. So using indirect evidence is also one way.
Okay. Thank you so much for providing us with this update in such an easy and digestible way. When do you expect the guidelines to be published online?
Oh, yeah, that's a good question. Now we are in September and the guideline is in review, and we are very excited to see which comments reviewers will provide us with. Hopefully it will only increase the quality of the guideline. And soon after we have adjusted with respect to the comments, it will be published during the autumn.
And where can we find the EAUN guidelines?
The easiest way is just to Google EAUN guidelines, and then you will be taken to the EAUN webpage. Then on the left, you have the table of content, and here you can just click guidelines, and you can choose which language you want. Some of the guidelines have been translated into Farsi and into Italian, and I think there's one in German too. Then choose the language, and then you have it absolutely for free, and you can go through the whole guidelines, or you can download it if you want to.
So thank you, Bente and Susanne. And let's end with this advertising of the EAUN webpage and the EAUN guidelines.
Thank you, Lisbeth, for inviting us to this podcast.
Thank you for listening.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.